Sleep is supposed to shut the world out. But for some people, it opens a door to murder, paralysis, and a body that forgets how to breathe. The strangest part is that the sleeper may never know who was awake.
Chronic insomnia at 3:17 a.m. At 3:17 in the morning, you are not dramatically breaking down. You are still in bed, phone face down, ceiling fan turning, alarm set for 6:30. Chronic insomnia is the repetition. You struggle to fall asleep, stay asleep, or wake restored at least 3 nights a week for more than 3 months, even when you had enough time and space to sleep. In the ICSD-3TR, that duration and opportunity matter because insomnia is not just choosing to stay up. Your bed starts training the brain for waiting, frustration, and dread. In the United States 2024 survey, 1 in 6 adults reported trouble falling asleep, and 1 in 5 reported trouble staying asleep. NIH links it to higher risk of high blood pressure, coronary heart disease, diabetes, and cancer. Next, stillness gets replaced by an urge in the limbs.
Restless leg syndrome.
You lie still, and your legs treat stillness like an alarm. A crawling burn starts in the calves. Then comes an electric itch you cannot scratch from the skin. Unlike periodic limb movement disorder, where the legs jerk after sleep takes you, RLS keeps you awake and fully aware. You rub, flex, press your legs into the mattress, then pace the room. Movement quiets it for seconds, then the signal rebuilds. It usually worsens at rest, especially in the evening and at night. Iron deficiency is the most correctable trigger, and roughly 20% of RLS patients are iron deficient. It also clusters with kidney disease, pregnancy, certain medications, and family history. Next, the threat moves from restless limbs to a throat that closes in the dark.
Obstructive sleep apnea.
After restless limbs, the room goes still. Then the snoring stops. 10 seconds pass. The chest strains, no air moves, and the sleeper snaps back with a gasp they may never remember. Doctors shorten the diagnosis to OSA, and it happens when the upper airway repeatedly blocks during sleep, cutting airflow down or stopping it completely. That cycle can repeat dozens or hundreds of times a night, lowering oxygen and forcing the heart to work through each interruption. The clues are loud snoring, gasping, daytime sleepiness, morning headaches, and foggy concentration. Obesity, large tonsils, narrowed airway anatomy, and hormone-related changes can raise the risk. Untreated, it raises the odds of stroke, heart attack, and serious cardiovascular trouble. And next, breathing is not the part that freezes. Sleep paralysis night hag episodes. In Newfoundland folklore, the old hag sits on your chest while you lie awake and helpless. The medical name is isolated sleep paralysis, REM sleep atonia persisting into wakefulness, or arriving before sleep fully takes hold. In normal REM sleep, that atonia shuts down most voluntary muscles so you do not act out your dreams. Here, the timing slips. Your eyes open. The ceiling is exactly where it should be. The clock ticks. Nothing in your body answers. You cannot lift a finger or call for help. Then, the waking brain tries to explain the impossible, and it may produce a presence in the room, weight on the chest, or shadowed figures. It feels ancient. It is biology, mistimed. Beth Goodyear's Kleine-Levin syndrome. After the night hag lets go, Beth Goodyear from Stockport did something quieter and more devastating. She slept through most of her life, in bursts. Doctors classify this as recurrent hypersomnia, sometimes called Sleeping Beauty syndrome, with roots traced from Brière de Boismont in 1862 to Willy Klein in 1925 and Max Levin in 1929. Beth developed it at 16 in 2011, and reports described episodes where she slept up to 22 hours a day. But this is not restorative sleep. You may wake confused, ravenous, fogged, detached from reality, then lose days or weeks again a few months later. The bedroom becomes a time vault, while school, meals, work, and relationships keep moving outside. Next, sleep does not just overtake the day. The immune system may help pull the switch. Pandemrix-linked narcolepsy. Type 1. After days vanish into sleep, warm static builds behind your eyes, then your knees buckle while you are still awake. During Europe's 2009 H1N1 campaign, Pandemrix, an AS03 adjuvanted vaccine made by GlaxoSmithKline and not used in the United States, became linked to later narcolepsy type 1 diagnoses in children and adolescents. About 30 million doses went out across 47 countries. In Finland, ages 4 to 19 saw 54 cases in 2010, and 50 had received Pandemrix. Incidence was about 9 per 100,000 vaccinated versus 0.7 unvaccinated. The suspected pathway was molecular mimicry between the virus nucleoprotein and neurons that produce hypocretin, the wakefulness signal narcolepsy type 1 destroys. The sleeping brain had quietly begun commandeering a waking body, and no one saw it coming.
Mike Birbiglia's REM sleep behavior disorder, window jump. Mike Birbiglia did not just fall out of sleep. He went through a second-story hotel window at a La Quinta Inn in Walla Walla, Washington, and needed 33 stitches. The diagnosis is REM sleep behavior disorder, a parasomnia where the normal paralysis of REM sleep fails, so the dream gets a body. Carlos Schenk, Mark Mahowald, and colleagues formally described it in Sleep in 1986 at the Minnesota Regional Sleep Disorders Center. You can punch, kick, shout, dive from bed, smash lamps, or injure the person beside you while dreaming of attackers. Birbiglia later dramatized the incident in Sleepwalk with Me, but the diagnosis can outlast the injury. A 2019 brain study found conversion to Parkinson's disease, dementia with Lewy bodies, or multiple system atrophy in 73.5% of idiopathic cases by 12 years. FDA's 2019 zolpidem complex sleep behavior warning. After a disorder that can turn dreams into movement, April 30th, 2019 made the bedroom look less contained. The United States FDA required a boxed warning for zolpidem, zaloplan, and azopiclone after reports of complex sleep behaviors tied to these sleep medications. The agency named zolpidem brands including Ambien, Ambien CR, and Stilnox, and listed people sleepwalking, driving while asleep, preparing or eating food, making phone calls, intimate behavior, and leaving the house, often followed by amnesia. The warning cited 66 serious cases over roughly 26 years, including 46 serious non-fatal injuries and 20 fatal outcomes. Kerry Kennedy's public case followed a July 13, 2012 crash on Interstate 684 in Westchester County, New York. She said she accidentally took zolpidem instead of thyroid medication and was acquitted in 2014. Next, sleep stops needing dreams because the automatic body itself begins to fail.
Congenital central hypoventilation syndrome. Worse still, the monitor beside your infant's crib is already beeping. No gasp, no struggle, just a capnography line climbing while sleep looks peaceful. Congenital central hypoventilation syndrome means the brainstem's automatic breathing drive fails, most dangerously during sleep. It was once nicknamed Ondine's curse. Mellons and colleagues gave the first modern clinical report in 1970, describing infants who breathed better awake than asleep. In 2003, PHOX2B mutations became the genetic anchor. CCHS affects around 1 in 150,000 to 200,000 live births, with more than 1,000 diagnosed worldwide. Carbon dioxide rises, oxygen falls. Survival requires mechanical support, usually lifelong nighttime ventilation through tracheostomy, mask ventilation, or diaphragm pacing. Sleep arrives, and the command to breathe may not.
Encephalitis lethargica at Beth Abraham Hospital. At Beth Abraham Hospital in 1969, you watch Oliver Sacks give L-Dopa to a post-encephalitic patient who has not moved voluntarily in decades. Konstantin von Economo had described encephalitis lethargica in Vienna in 1917, during a pandemic lasting roughly 1916 to 1930. Historical estimates cite over 1 million cases worldwide and hundreds of thousands of deaths, with incomplete reporting. In the acute phase, you could sleep for impossible stretches, lose speech and movement, or develop paralyzed eye muscles, tics, and psychosis. Survivors could later enter rigid, statue-like Parkinsonism, still sensing time pass inside a body that would not answer. L-Dopa briefly restored speech and motion, then brought severe side effects and collapse. Encephalitis lethargica did not erase consciousness. It locked the door from the inside. Kenneth Parks's sleepwalking homicide. Start at the police station. Kenneth Parks arrives with badly cut hands, and the question is not only what happened, but who was awake for it. On May 24, 1987, he drove from Pickering, Ontario to his in-laws' home in Scarborough, roughly 23 kilometers away. There, Parks attacked Barbara Ann Woods and Dennis Woods with a tire iron and a knife. Barbara Ann Woods died.
Dennis Woods survived injured. Then, Parks drove to police. You do not remember any of it. Parks said he did not either. The clinical answer was sleepwalking, a NREM parasomnia that surfaces from deep sleep, often in the first third of the night, leaving little or no usable memory behind. Parks was acquitted, and in 1992, the Supreme Court of Canada upheld that acquittal in R versus Parks. A brain can act before the self arrives. Fatal familial insomnia. Fatal familial insomnia starts with a brutal contradiction. Your bed is there, your body is exhausted, but the thalamus, the brain relay that helps organize sleep, is being destroyed by a misfolded prion protein. The inherited trigger is autosomal dominant, meaning one faulty copy can be enough, a PRNPD178N mutation with methionine at codon 129. In 1986, Elio Lugaresi and colleagues described it in an Italian family in the New England Journal of Medicine. As the thalamus degenerates, the spindles, K complexes, and slow-wave architecture that define sleep vanish on EEG. In your 40s to 60s, insomnia arrives with sweating, a racing pulse, panic, hallucinations, ataxia, and cognitive decline. Survival commonly runs 7 to 36 months. The switch is not stuck, the switch is gone.